very well.
On Monday, the morning before we left.
Thank you, everyone, for coming. My name is Bob Huckfeld. I'm director of the UC Center in Sacramento. And I'm happy to introduce Cordula Dick-Muehlke from Irvine today to talk to us about Alzheimer's disease and public policy. Thank you for coming, Cordula.
I'm happy to be here. Hi, everybody. I'm the Director of Education at the UCI Institute for Memory Impairments and Neurological Disorders, and towards the end of the talk, I'll show you a little bit about what we specifically do at UCI MIND. So I want to talk a little bit first about just the impact of Alzheimer's disease, how many people are affected, and as you can see on the slide, that today in our country, someone develops Alzheimer's disease every 68 seconds. By 2050, that'll actually be once every 33 seconds. It's a huge problem, and it has a huge societal cost, as you can see, of $200 billion, and that's just direct costs. That's not all the human indirect costs that are paid by family members. Interestingly, as you can see, there are 5.4 million people today with Alzheimer's disease, and look at the number of caregivers. The number of caregivers is nearly triple that, at 15.2 million. So it means for every one person with the disease, there are at least 3 close family members involved in care. This disease doesn't leave anybody unaffected. This is a collage of the many famous people who have been affected by Alzheimer's disease that you will, I'm sure, recognize. Certainly not going to identify them all, but just point out currently still living Coach Pat Summitt, and then Glenn Campbell, who's most recently announced that he has Alzheimer's disease as well. So where's this disease going in terms of numbers? Well, the projection is that by 2050, there will be anywhere from 13.5 million to 16 million people in the United States affected by Alzheimer's disease if we have not made any further progress towards better treatments, ways to prevent or delay the disease. Here in California, I want to particularly point out, there's some Orange County data specific to us, but particularly point out that 10% of the people with Alzheimer's disease live in the state of California, and it's the 6th leading cause of death in our state. We'll come back to the other bullet as well, that 1 in 8 of us, baby boomers, people my age, will develop Alzheimer's disease. 1 in 6, some other form of dementia. So the numbers here in the state of California will double. This is people 55 and older, to 1.1 million by 2030, which is only 18 years away. It's not very far away at all. And remember what I said about 3 for 1. So what you have to take into consideration is there's another 3 million caregivers that you need to add to that number to get a true number of how many people are going to be affected by this disease. The yellow bars versus the blue bars show you that the vast majority of people with Alzheimer's disease in our state and across the nation actually are 75 years and older. So that means they're also dealing with a lot of other illnesses and issues as well. Particularly important for our state is the fact that the number of people of Hispanic background and also of Asian background are both going to triple by 2030. And there specifically, the number of Hispanics is affected is going to grow to almost 300,000. And of Asian Pacific Islanders is going to grow to almost 200,000 in the same time span. So, you know, in terms of public policy and in terms of where we need to go with this disease, we need to take the needs of diverse persons into consideration and how we are going to meet those families' needs. Well, there are a lot of risk factors for Alzheimer's disease, but the number one risk factor is growing older. And that's one of the reasons that you see the disease occurring more and more, because a large generation of baby boomers is now reaching retirement age. What this particular slide illustrates for you is just several studies that have been done. But all of these studies, even though there's some variabilities in terms of the percentage of increase, show that the older you get, the more at risk you are for Alzheimer's disease. Essentially, the prevalence of Alzheimer's disease doubles every 5 years, beginning at 65. So you can see here about 4 to 15% over age 75. Some studies indicate that as many as 1 out of 2 people over age 85 are affected by the disease. This particular information actually came out just yesterday in the LA Times. It's actually from a JAMA article, Journal of the American Medical Association. And this answers the question why we didn't see Alzheimer's disease so prevalent in past decades. Look at that life expectancy and how it has changed in the last 68 years. In the last 68 years, the average life expectancy across men and women for African Americans has gone from 33 years to 74.1 years. That's a 125% increase. And for Caucasians, from 47.3 years in 1940 to 78.7 years, which is a 66% increase. So we are now living into the age when we become most at risk for Alzheimer's disease. So just briefly, I wanted to share with you what the progression of Alzheimer's disease is. And we now recognize that Alzheimer's disease starts in your brain decades before you ever show clinical symptoms. So there is a long silent period of the disease where your brain is being affected, but you don't show any outward signs of the disease. And that's the preclinical part of the disease. At some point, however, you start to become aware that there's some difficulties happening. And perhaps someone that's close to you starts to notice some difficulties as well. These are subtle changes, and you move into a phase called mild cognitive impairment, when you or someone you love notices there's a problem. It is significant when you're tested with cognitive tests. It's significant versus other people your age. But basically, you're still able to function in your daily life. You're still able to do your everyday activities with relatively no problem. The reason this line happens to veer off in 3 ways is because mild cognitive impairment greatly increases your risk for advancing Alzheimer's disease. However, it is not a fait accompli, and some people remain stable, and a few, for reasons we don't know right now, actually get better. But as I said, it greatly increases your risk, and if those brain changes continue to worsen, you will develop a full-blown dementia. And a full-blown dementia is characterized by 3 features: a loss of intellectual ability, affecting your memory, plus 1 or more other cognitive abilities, so it might be language, reasoning, judgment. And that impairment is so severe, it interferes with your ability to do your everyday activities, to carry out your work life, your social life, eventually to take care of even your most basic needs. Now, there are a lot of causes for cognitive impairment and dementia, and this slide summarizes the various causes. And we won't go into all these various causes, but basically it's to communicate that there are a variety of causes, and they basically fall into three categories, which is causes that are reversible, which can be corrected and treated, and your cognition comes back to normal. And in fact, the most common reversible cause of cognitive problems in the elderly are medication side effects. So now, the reversible causes only account for about 10 to 15% of all cases of dementia. They're non-progressive types of dementia. Those might be like a traumatic head injury, such as in the news a lot, football injury, repeated football injuries, concussions, that, excuse me, that's an incorrect example. A traumatic head injury more like a traumatic head injury that you would have in an auto accident where you would remain stable, you would have some cognitive impairment, but there would not be a progressive change. And then the progressive types of dementia, which actually account for about 85% or more of the dementias, with Alzheimer's disease being the most common. And there are other types of dementia that you may have heard about. Vascular dementias related to stroke, dementia with Lewy bodies, dementia related to Parkinson's disease. But the number one cause of dementia is Alzheimer's disease, far and away. So this slide illustrates that for you. Over half of all dementias, the primary cause is Alzheimer's disease. You can see dementia with Lewy bodies, which has some features similar to Parkinson's disease, but is not Parkinson's disease and has a progressive decline. It's the second most common cause, followed by vascular dementias. What's very interesting, though, is when a patient goes to brain autopsy, people in these categories here, very, very often, Alzheimer's disease is also present in the brain, in addition to the dementia with Lewy bodies or the vascular changes. So basically, Alzheimer's disease is the primary or a secondary cause of dementia in 75% of all cases. So what is this progression like once you cross that threshold from mild cognitive impairment to Alzheimer's disease? Well, it lasts anywhere from 8 to 20 years. The average lifespan is approximately 9 years after diagnosis. The person is becoming progressively worse with cognition, not just memory, but all other cognitive abilities, language, reasoning, judgment, their visual spatial abilities, their abilities to find their way around the world. But it's not just a disease that affects you cognitively, it also affects your behaviors and personality. So you see people becoming more apathetic and depressed and irritable or having personality changes and then exhibiting difficult behaviors, aggressiveness, wandering, tremendously difficult behaviors to manage. And in fact, one of the major causes of institutionalization is these behaviors that are so difficult to manage. Into the severe stages, the person loses the capacity to do even the most simple things for themselves. Dressing, grooming, ultimately bathing, toileting, and becomes eventually bedridden, with most often the cause of death being that the person succumbs to an infection such as pneumonia. So Alzheimer's disease has this tremendous financial cost today. These are the direct costs, as you can see, with Medicare being the largest proportion right now. So that totals $200 billion. Families are paying or spending $33.8 billion straight out of pocket. So it's an untenable societal burden if you think about the growth in the number of individuals affected by Alzheimer's disease. This is something that's going to break our bank in terms of health care. And people with dementia, clearly, healthcare costs are much greater for them. than for people without dementia. So overall, as you can see, this is Medicare spending, 65 and older. Overall, all categories together, healthcare costs for people with dementia are 4 times as high. If you take a person with dementia that they don't have any other coexisting medical conditions, you can see that the costs are 10 times as high. If that person has 1 or 2 other illnesses, chronic obstructive pulmonary disease, congestive heart failure, diabetes, the cost is 3 times as high. And if they have 3 or more coexisting conditions, the cost is actually twice as high. So, and most people with dementia, with Alzheimer's disease, remember I said are 75 and older, most of those people have multiple coexisting health problems that they're dealing with. So, but right now, I think we need to recognize that our society is escaping even further costs because we rely on families. Families are the foundation of long-term care. And this is the most recent data from the Alzheimer's disease facts and figures report that the Alzheimer's Association puts out every year. Look at those numbers in terms of, I didn't correct the slide, I'm sorry. I looked at this last night and saw I put dollar signs here, and that's not correct. Hours of unpaid care, look at that. In California, 1,716,000,000. In the United States as a whole, 17 billion hours of unpaid care calculated out. Here in the state of California, $21 billion nearly of unpaid care. I'm going to get back to this in terms of the healthcare issues that caregivers have, because healthcare costs are also greater for them. I just pointed out to you the excess healthcare costs for people with dementia. Well, caregivers also have health issues that are directly related to the task of caregiving that then increase also their healthcare costs. I wanted to speak a little bit specifically about caregivers, because that's the foundation that we rely on, and we aren't sustaining our foundation when it comes to the kinds of things one might be concerned about from a public policy perspective. So there are lots of studies on caregiving, and I think it's really important to, when you look at those studies, to look at whether they're lumping all caregivers together or they're specifically looking at caregivers of people with Alzheimer's or another dementia. And so like this study did, they compared those groups, and you can see one of the impacts is that caregiving for people with dementia is considerably longer. So the blue bars being those caregivers. 43% caring for 4 or more years, 32% for 5 or more years. It's a long duration of caregiving. So what are the costs of caregiving, the human costs? You can see some studies in these two. In one case was comparing caregivers of people with Alzheimer's to caregivers of people who are physically disabled, and that's on the left. And you can see that the additional impact of having someone have cognitive limitations really increases the stress, it increases the impact of having to make changes in one's personal life and one's work life. Then on the right, in another study that compared caregivers of people with Alzheimer's as compared to non-caregivers, you can see the mental health issues that are coming up. 33% of caregivers at least experience depression. 61% of caregivers that were surveyed by the Alzheimer's Association recently reported their stress as being high to very high. And similarly, a similar percentage, 53%, rated the financial impact as high to very high. The literature clearly has demonstrated that to be a dementia caregiver is the most stressful type of caregiving. And it has health consequences, significant health consequences that are listed here. You know, people are expressing more stress hormones, which then places them at greater risk for diseases, cardiovascular disease, diabetes. They're having more difficulty in terms of immune functioning. If you're 75 and you're a caregiver, you're already at risk as an older adult for greater susceptibility to the flu or other illnesses, and this further weakens your immune system. Caregivers themselves are at increased risk for more cognitive decline. They have higher levels of coronary disease, and one study showed that caregivers who report being under strain are at a 63% greater risk for death. And I've worked with families for a long time, and I have seen caregivers predecease their loved ones because of the challenges of care. So in this particular study was done by the University of Pittsburgh. I think there's a couple things to point out. Again, these were specifically Alzheimer's caregivers. In terms of caregivers across the United States who are caring for a variety of people, whether it might be a child or an adult with a different type of illness, you know, the average age is somewhere in the 40s generally. You know, here we're talking about, again, an older caregiver, 61 years old. Look at that, 83% women. This is a women's disease. It affects women more. Women are at slightly greater risk, and women are the majority of caregivers in our society. These particular care recipients had a moderate to severe level of dementia. In terms of the point here about health, there was a significant decline. Across the 18 months these people were studied, these caregivers were studied, there was a significant decline in health. And look at that, 25% increase in use of all types of healthcare services as they're listed here, from doctor's visits to emergency rooms. I believe emergency room use was twice as high, and doctor's visits were approximately 3 times as high. They estimated the increased cost of the health care for caregivers is $5,000 annually. Caregiving also affects your employment status. And again, these are all places where public policy can definitely have an impact. Hopefully you can read that, because there were so many categories. It's a little bit small, but 65%, it's 2/3 of caregivers are saying, you know, they had to go in late, leave early, take time off, adjust their work schedule. 1/5 of them are taking a leave of absence. A lot of them are changing their work, you know, schedule to part-time, giving up a promotion or taking a less demanding job, giving up working entirely. 1 out of 10 caregivers give up work entirely to take care of someone. Almost lost job benefits, probably because they changed their work status, and, you know, almost suffered a dismissal. Again, close to 1 out of 10 are choosing early retirement. These are significant impacts to the caregiver, you know, from whether one takes it from one's perspective of self-esteem and one's status in the world, to give up a job, to the financial impact that has on the family. The problem we face, and I think a problem that has to be paid attention to in terms of public policy, is, are the baby boomers going to be willing to be these caregivers? What do we know about that? And there was an interesting study that just came out earlier this year in the Gerontologist about baby boomer caregivers, and these were baby boomer caregivers in Quebec, and researchers did interviews with these 39 caregivers. They were structured interviews, and then they did thematic analyses, and was really very, very interesting findings that people my age are more resistant to being caregivers in the way that my mom was a caregiver, or, you know, that the current generation are being caregivers. Baby boomers wanted to be much more circumscribed. They don't want to have to sacrifice their lives for the caregiving. They don't want to lose their identity. And so for these caregivers, services were really important because they wanted to delegate the personal tasks. They weren't about to, you know, take care of their parents' toileting needs or personal care needs. They wanted to be able to delegate that. And interestingly enough, though, what was also important to these baby boomers was not just that these services provide this kind of basic care, but that the services also enhance quality of life for their loved ones, that they provided stimulation, rehabilitation, that there was a quality of life element. So they really viewed their roles as caregivers very differently than caregivers of previous generations, in the sense that their job was to manage the care and to improve quality of life. It wasn't there to be there to do the care, but it was to be there to make sure that the care that somebody else was providing was good care. That's a really different perspective, because then there's an expectation that somewhere in society there's these people or care providers or services that they're going to delegate this to. It was also interesting that these baby boomers also expected that there would be venues for them to get support themselves, as well as, you know, this idea that, you know, you're a caregiver and you're a caregiver because you're part of a family and you should just do it out of the goodness of your heart and do it for free. You know, many of the people in these interviews talked about that somehow society should compensate caregivers for doing this. I think that's really interesting in light of the current challenges we're having to our in-home supportive services in this state, in this budget cycle and in previous budget cycles. That really cuts back the opportunity for caregivers who are of low financial means to get any reimbursement for their care. So caregiving is no longer like this normative thing that you do, because the new normal, as expressed by these baby boomers, was it's important to have a professional life, it's important to have a social life, it's important to keep active, it's important to fulfill myself as well as to do my caregiving. So the attitudes towards caregiving are very much imbued by baby boomer values of autonomy and also self-actualization. So, and interestingly also, the boomer caregivers were more willing to use the label caregiver because they wanted it recognized that they were doing something over and above what they thought should be expected of a child or a spouse. So I'm not sure from a public policy perspective, we've thought about that in terms of, well, maybe this source that we've been relying on for long-term care is just going to exist forever. Additionally, baby boomers are a generation that's unprepared for their own aging, and this particular study showed that 2/3 of us worry about if we're going to be able to care or pay for long-term care, and nearly everyone does not have long-term care insurance. 58% feel financially unprepared, and this is really scary. 68% of these, if I remember correctly, it was around 1,300 California voters that were surveyed. 68% of them said they couldn't afford 3 months of care in a nursing home. 69%, and similarly, 57% couldn't afford 3 months of in-home care. They also looked at how many said that they could afford 1 month of care. It was right around 32%. A third of us said we couldn't afford 1 month of care. also, 70%, and this really reflects the need for education, incorrectly believe that Medicare is going to take care of one's long-term care needs. And from a public policy perspective, 2/3 said long-term care is an important priority for public policy. This survey was done in 2010, I think, yeah. Saving lives, saving money. How do we save lives? How do we save money? Well, in terms of the state of affairs today with Alzheimer's treatment, we only have treatments today, medications that are what we call symptomatic. And what I mean by that is they can improve your symptoms, but they can't change the course of the disease. So today, we don't have any way to delay the onset, to slow the progression. And so what's happening is we're seeing that more people are dying of Alzheimer's disease while less people are dying from other major diseases, because we've made more progress in terms of treatments and cures for some of these diseases. So you can see this percentage change over that period of time, where the number of deaths to Alzheimer's disease has increased by 66% versus, for example, HIV, which is decreased by 30%. So we're not making the progress that we need to be making. Just to have explain the impact of what would happen if we had a better treatment, a way to delay, prevent the disease. The Alzheimer's Association did an interesting study called the Changing Trajectory of Alzheimer's Disease. So here you can see that, and this was done in 2010, so the number's a little lower than today, but in 2010, about 59%, about 60% of people with Alzheimer's disease were in the moderate to severe stages. So that's when they start to become more difficult to care for. If everything stays the same as today, in 2050, again, we'll have just over 50% that are going to be in the moderate to severe stages. So what would happen if we had effective treatments by 2050? How would this change our projections in terms of numbers and also the distribution of people at these various stages of the disease? So first of all, if we were able to push back the onset of the disease by only 5 years, it would have a huge impact. It would reduce the number affected from 13.5 million to 7.7 million. That's just a huge impact from a human perspective and from a financial perspective. Now, it would look a little bit different if we slowed the progression. If we slowed the progression, we actually would have more people, because all we're doing is slowing the progression. But what we're doing if we slow the progression is we're maintaining quality of life, because here 60% of the people are in the early stages. So both of those are very important goals, to push off the onset, keep people healthy and cognitively functioning longer, and then if they get Alzheimer's disease, slow the progression so they can stay in the early, most functional stages as long as possible. There was an earlier study that was done, and it was from 2004, but I still think it's a valuable illustration. If we could do both of those things, if we could slow the progression and delay the onset, this projected that instead of having 13.5 million people, we'd have 8.1 million people with Alzheimer's disease in 2050. So a decrease of 40%. So what does that mean? It means we need an investment in research. Today, the NIH spends about $500 million a year on Alzheimer's disease, even with, and everyone in our field is so pleased that President Obama increased funding for Alzheimer's disease by $130 million recently, related to the National Plan for Alzheimer's disease. But I think we still have to look at that relative to the amount our country spends on other diseases, about $6 billion on cancer, about $3 billion on AIDS. So $500 million for a disease that affects so many people is a drop in the bucket. And we need to change that if we're going to make progress. So some of the public policy themes I think, came out, or I was trying to express, are definitely, if we're going to avert this crisis, both human crisis and financial crisis, we have to invest in research. Our state has done some great things, like with the California Institute for Regenerative Medicine, which is working on these kinds of problems now. But we need much more. We also can't take the family for granted anymore as being the bedrock of care in our society. And we have to be thinking about the availability of services for caregivers. Again, I would point out that this year, our state is eliminating, right at this point, the budget's not signed, but it's eliminating the caregiver resource centers that provide resources for families and for caregivers all over the state of California. That doesn't make sense in this environment with this level of need. When services aren't available and when caregivers don't get support, and when baby boomers say, yeah, I really don't want to do this the way my mom did, well, guess what? Then the older adult is also at risk for elder abuse. And cognitively impaired people who are unable to remember the abuse or unable to remember that they signed over their home to someone are at huge risk for abuse. We also need to really work on caregiver-friendly employment practices, whether that's benefits, flexible work hours, wellness programs. There's a lot that can be done there. I was really pleased to serve on the California Alzheimer's Disease State Plan Task Force in 2011. March of 2011, California Legislature received this plan. You have the brief summary of the plan. I brought that for you. The main goals of that plan